Hill-Rom, a trusted name in quality healthcare products and services, brings you the Vest Airway Clearance System, the award-winning Model 205. The Vest system is a proven tool designed to administer automated airway clearance therapy. It's effective for patients suffering from both acute and chronic respiratory conditions. The Vest Airway Clearance System helps reduce therapy time compared to CPT and is proven just as safe. The technology provides consistent therapy with minimal patient interaction and continuity of care across the continuum, from surgery to ICU to extended long-term care in the home. Hill-Rom understands the need for infection control. The Vest system provides disposable single-patient use vests. They're meant to be used over multiple treatment sessions during a patient's hospital stay. The disposable vests connect to a programmable air pulse generator, which rapidly inflates and deflates the disposable vest. This expansion and contraction of the chest wall creates airflow within the lungs. The pulsations move mucus toward the larger airways, where it can be cleared by coughing or suctioning. The Vest Airway Clearance System delivers a therapy known as high-frequency chest wall oscillation. The Vest Airway Clearance System Model 205 consists of several components. Latex-free disposable vests are available in either a full-fitted style or a short wraparound style. The air pulse generator with a control panel that displays the various programming modes, system settings, and system messages, and air hoses, which attach to connector ports on the air pulse generator and to the disposable vest. Optional disposable hoses are also available for treating patients with infectious conditions. For easy transportation, the air pulse generator rests on a mobile stand with 4 locking caster wheels. To raise and lower the air pulse generator to a comfortable working height, there's an adjustment lever. And there's also a storage basket that can hold disposable vests. During a treatment, the optional remote control may be used by either the clinician or patient to pause or resume the oscillations. To save time, during therapy, patients may also use a nebulizer treatment prescribed by their physicians. The Vest system saves time, reduces the need to position patients, and provides consistent therapy every time. The Vest system is serving thousands of patients and is prescribed for a wide and rapidly growing number of diagnoses. Treatment indications include secretion retention associated with impaired ventilation and/or gas exchange, ineffective cough or secretion clearance due to immobility or muscle weakness, and airway clearance dysfunction resulting in thick, sticky mucus. The Vest system is proven to be effective in the delivery of consistent airway clearance therapy for the treatment of these conditions. For optimum patient comfort, both disposable vests are fully adjustable. To fit the wrap vest, roll the patient onto their side and slide the disposable vest under the patient just below their arms. Roll the patient back and pull both ends of the wrap vest around the patient's chest. Attach the ends of the wrap vest so it fits close to the body and still be comfortable. Make sure a flat hand fits under the vest. The disposable wrap vest reduces the risk of cross-contamination and is particularly effective in treating post-surgical patients, mechanically ventilated patients, or patients with body types that make fitting a garment challenging. To fit the full disposable vest, position the garment behind the patient and attach the shoulder straps to the front. Adjust the shoulder straps so the bottom edge of the full vest is at the top of the patient's hip. Connecting the air hoses is easy. Push one end of each hose into the connector ports using a slight twisting motion. For the disposable wrap vest, pull up the tab and push one end of each air hose into the hose slits. Insert approximately 2 inches. If necessary, secure the air hoses to the side of the wrap vest with the attached loop. For the disposable full vest, push the other end of each air hose over the full vest air hose ports, using a slight twisting motion to help keep them in position. When the vest airway clearance system is first plugged in, the unit goes through a self-calibration, which may take up to 15 seconds. It will then display the software revision and the hour meter reading for 10 seconds or until the on button is pressed. The Vest Airway Clearance System by Hill-Rom allows users to easily change the language on the display between English and Spanish. Consult the user manual for detailed instructions on this procedure. The Vest System Model 205 has 3 operating modes: Normal, Program, and Ramp mode. For quick and easy starts, use the Normal mode. Press the arrow above Normal. The screen will show the previously programmed frequency, pressure, and treatment time settings. To adjust frequency, press the arrow buttons until the prescribed treatment is displayed. The frequency is adjustable between 5 and 20 cycles per second. To modify pressure settings, press the middle up or down buttons until the prescribed pressure is shown. Levels are adjustable between 1 and 10. Treatment time is adjusted by pressing the right arrow buttons until the prescribed treatment time shows on the screen. Treatment time may be set between 1 and 60 minutes. Press the on button to inflate the disposable vest. Press the on button a second time to begin therapy. The set treatment time shows as it counts down to 0. Settings may be adjusted throughout a treatment without stopping oscillations, and you may pause a treatment during a session at any time. Simply press the off button. When the unit is paused, the disposable vest deflates and pulsations stop. To resume, press the on button. If it's necessary to end a treatment session before it's complete, press the off button twice. The message that reads "Incomplete number of minutes remain" is shown. When a treatment session is complete, the Session Complete message is displayed. To set up treatment for the next patient, return to the main screen by pushing the on button. The Program mode allows caregivers to program up to 8 points with various settings within a single therapy session. Pressing the arrow above Program will run the previously created program. From the main screen, press the middle down arrow to create a new program. The screen will display the adjustable settings of frequency, pressure, and treatment time for the first programming point. Adjust each of the settings to match the prescription by pressing the up and down arrow buttons. Continue on to programming point number 2 by pressing the on button. Repeat the procedure, adjusting each setting per the prescription. Note that you may move to a previous point by pressing the off button. If the prescription does not call for 8 programming points, set the time to 0 minutes for the next programming point after setting the last prescribed treatment. To return to the start of the program, press on. Press the on button a second time to inflate the disposable vest. Press the on button a third time to begin the treatment program. The set treatment time counts down to 0 for each programming point. Therapy automatically ends after the air pulse generator has gone through each programming point. The Vest Airway Clearance System offers a ramp mode to ease patients into therapy from a lower setting to a higher setting within a % of the total therapy time. Press the arrow above ramp to run the previous ramp program. From the main menu, press the button under New Ramp. Adjust the percentage of time you will be in the ramp mode using the right upper and lower buttons. Press the on button to advance to the next screen. Adjust the starting frequency and pressure settings using the arrow buttons. Press the on button again to advance to the next screen. Adjust the ramp end frequency and pressure settings and set the total therapy time using the upper and lower buttons. Press the on button to confirm the settings. Press the on button once more to inflate the vest and again for oscillation to begin therapy. Note that therapy settings may not be changed while the unit is ramping. However, treatments can be paused by pressing the off button. When a treatment is complete, remove the air hoses from the inflatable vest open the disposable vest and leave it under the patient for the next treatment. The vest system requires no routine maintenance. Follow your institution's guidelines for cleaning reusable equipment. Wipe down only the outside of the unit between patients or when soiled, and never immerse the disposable vests, air hoses, or the air pulse generator in water or any solution. Avoid excessive moisture or use of harsh cleaners. Only authorized Hill-Rom technicians should service the vest airway clearance system. Hill-Rom has a large service and support staff dedicated to providing the absolute highest standards of customer service and product support for the vest airway clearance system. The vest airway clearance system is proven as safe as CPT and helps reduce therapy time. The system delivers consistent therapy from start to finish, with minimal patient interaction and continuity of care across the continuum, from hospital to home. The Vest Airway Clearance System. It's safe, easy, and effective airway clearance therapy to help patients breathe a little easier.